Hi guys, Dr. Aman Arora here from Arora Medical Education. This video is about 5 key things to think about before you start any new rotation as a GP trainee. It could be in hospital like pediatrics, or it could be in your general practice rotation as a GPST1 or GPST2. And I think back to my own GP trainee rotations, I probably didn't get the most out of them as I could have. And thinking about these 5 things before, I know would have made better use of my rotations when I was a trainee. So we're going to talk about 5 key things, and also I'm going to give you a 10% discount to our brand new GP Trainee Max online course for new GP trainees. So stay tuned for that, but let's start with the 5 key things to think about doing before you start a rotation. The first thing I suggest doing is think about your weaknesses in that particular field. Whether it's a job or rotation that you're looking forward to or not, think about what am I weak in and what can I stand to benefit from in this rotation. So for example, when I did my A&E rotation, if I'd have thought back as to what I would be weak at, I would have known that I wasn't very good at assessing injuries like knee injuries, ankle injuries. Where do you think about x-raying it, for example? But had I thought about that beforehand, I knew I could have gone into that rotation and made sure I came out understanding that in more detail and being a bit more confident about it. Say for example, my ENT rotation as a GP trainee, I knew before I went into ENT that I wasn't very good at looking in ears using an oroscope, for example. I couldn't see eardrums properly, etc. So had I thought about that beforehand and acknowledged that I was weak in that, or maybe hadn't had enough experience, then I maybe would have made sure that when I came out of that rotation, I'd done everything I could to become a little bit more confident with it. When I did my pediatrics rotation, for example, looking back now, I should have thought about the fact that I wasn't very comfortable in dealing with very, very newborn or young babies. I hadn't had a child myself by that point, and it was quite a scary thing. But had I thought about that beforehand, I could have made sure I did whatever I could to feel more confident about that when I came out the other side. So have a strong think about the weaknesses that you have in a particular rotation or area, so when you jump into that rotation, you already have an idea about what you can kind of target, and your PDPs are already starting to form before you even begin that rotation. So think about your weaknesses, acknowledge them, so you can do something about them in your 4 or 6 months. Number 2, try and talk to somebody who's already done that particular rotation. It's amazing how much you'll learn from the mistakes they made or the experiences that they had. For example, when I did my ENT rotation, I knew people who had done the rotation before me, and I didn't really speak to them about the rotation. I went in and I kind of had to learn it all myself. But had I spoken to somebody who'd just done it, then I could have asked them, look, what are the best clinics to go to? Or, what are the things that I should be avoiding? Or what are some tips to try and make on-calls easier? Or, what are things that I should know about the ward? Who should I approach for certain types of queries or questions? There is so much knowledge in people who have done things before us, and sometimes we don't take advantage of that. So if you're in a position where you know somebody who's done that rotation, and even if you're not, when you go to your VTS session, find out somebody who's done that rotation previously. It could be an ST2 or an ST3. If you're an ST1, for example, find out, ask a few questions. They'll be more than happy to help. But the amount of shortcuts that you will gain, the amount of things that you will take time out of in terms of working at yourself, will be invaluable. And when you find out from somebody a few of the key things and a few tips before you even start your rotation, you already feel slightly ahead. You kind of don't feel as intimidated that you're going into a brand new ward, brand new team, brand new speciality, because that can cause a lot of stress. So find somebody who's already done it and ask them as many questions as you can think of. The third thing that's really important to do before you start a rotation is plan or think about the assessments that you're going to have to do in that rotation. Now, these are mandatory things, so think about the mandatory ones first. So what are the things that I need to make sure I've done by that stage of training? It could be CBDs, it could be COTS, it could be mini CX, etc. So get the mandatory ones thought about so you can start to plan and do them as early as you can in your rotation. Often what happens, this happened with myself, is that I started a rotation, the first month or so I was just getting used to everything. I didn't even think about assessments, and then suddenly it may have got to maybe 2 months to go, and I realized, okay, I have to get this many assessments done. So it's quite a rush and a bit of stress to get them all in before that rotation ends. So number 1, think about the mandatory assessments that you have to do before you start that rotation, so you can start to plan. And when you have your placement planning meeting, or when you have a chat with your supervisor early on, you can start to talk about when these assessments can get done, so you feel on top of them. But secondly, think about some of the assessments that might be really useful to do in that particular rotation. So for example, your SEPs, your CEPS, and the examinations that you have to be assessed on when it comes to GP training, think about, okay, in this rotation, which steps can I do? The mandatory ones, which can I tick off, and which are the other ones that I think might be beneficial to me in GP training, and start to plan getting those assessments done at some point. So have a think about assessments before you start your rotation, not when you're 1, 2, 3, 4 weeks into rotation, when suddenly you have to panic and try and get them all done in a very short period of time. So get the assessment plan before you start. The fourth thing I think is really important to think about before you start a rotation is think about which clinics should I be attending in this rotation to maximize my benefit from me being a GP trainee. Now, this is really important. I didn't think about this and I should have done. For example, in pediatrics, there are so many clinics that I could have gone to that would have made such a difference for me in terms of my training as a GP trainee. For example, pediatric allergy clinics or pediatric asthma clinics. These are things that I didn't go to, but had I thought about beforehand and planned a little bit, I could have made sure I went to at least one of them in my rotation, so I would have understood a bit more about pediatric asthma when I did it or saw patients in my GP setting. Now, yes, you can do this when you start your rotation, but if you think about it beforehand, again, it starts to get your mind thinking about PDPs. What are the kind of things that I think might be beneficial for me? Of course, there are some clinics that you are going to be rotated into anyway that you have to do, but this is more for which other ones can I attend for my own learning benefit. Remember, you're there to learn as well, and everyone has individual learning needs. But if you don't think about them and plan them beforehand, then it's very difficult to make the most out of it when you're thrown into that rotation itself. So when it came to ENT, for example, yes, I went to core clinics that I had to do, but also there were so many other clinics that I could have gone to that are personal for me, because it goes back to point one, understand what you're weak in, then you can start to plan which clinics can I go to, because clinics are really important for a couple of reasons. Number one, you get to learn lots of things about the actual area, but you start to understand a bit about how clinics interact with primary care, and how when you're sitting in GP land, you get to read some of the clinic referral letters that GPs have done, so you learn that way, and you also read or you start to write your own letters back to GPs, and you can start to think about, if I was a GP, what would I want to know about the situation? So again, attending clinics is useful, but yes, do the ones that are mandatory, but plan before your rotation which are the 3, 4 or 5 that I think I would like to attend at some point in my next 4 or 6 months, and that will make sure you get them done so you get the maximum benefit. So plan your clinics and think about how they can jump into your PDP as part of that rotation. And the fifth and final thing that I'd think about is make sure you please plan your leave well in advance of your rotation. If you know you want to take annual leave at a certain point, plan it beforehand, so the moment you start that rotation you can get that leave requested. Think about study leave. Look at what type of courses you want to go to. Think about which exams are coming up, and therefore when would I think about attending certain courses. Plan ahead, because what often happens is everybody else might have done this, so you start your rotation and then maybe 2, 3, 4 weeks into it, once you've settled down, you start to think about, maybe I should take a bit of annual leave, and by the time you come around to thinking about taking it, those dates may be unavailable, or for whatever reason you've been rotated and you can't swap them. Maybe there's a really important course that you're coming up for AKT, hopefully our AKT course, but maybe you're thinking about something like that, but you can't go on it because you haven't planned in advance and you haven't got leave request forms in. So before you start your rotation, have a little bit of a plan, have a think, what kind of leave might I be looking at? The courses in terms of study leave, but also annual leave as well. So, because please, you don't want it to be that you miss out on these things because you haven't planned enough, and the best time to plan it is before you even start that rotation itself. So please don't miss out and plan your leave. So hopefully that's been of some value. 5 key things to think about before you start a rotation as a GP trainee. I wish I knew them myself before my own rotations, but unfortunately I didn't. I learned them on the other end of being a GP trainee. So 5 things to think about. Remember, people often come to you and say, I'm not looking forward to A&E, I'm not looking forward to acute medicine, I didn't want to get pediatrics, or I wanted psychiatry. Whatever rotations you get as a GP trainee, it's up to you to make them work for you, and planning these things in advance can really help. Right, so our 10% discount, like promised, we have an online course. It's called GP Trainee Max. It's a half-day online course that you can subscribe to for 1, 3, 6, 12 months. And it covers basically everything you need to know as a new GP trainee or a new GP ST1. The assessments, the portfolio, the learning logs, reflection, PDPs, the exams, how to get the most out of your rotations, everything that you essentially need to know before you start, or if you just started as a new GP trainee. So you look at the website, auroramedicaleducation.co.uk, look at the online academy, and you'll find the GP Trainee Max online course as a sample that you can watch to see if it's right for you. But if you want 10% off that, just for having watched this video, send me an email, aman@auroramedicaleducation.co.uk, aman@auroramedicaleducation.co.uk, and say, I just watched the rotation tips video, I want 10% off the online course for GPSC1s, and I will send you a code that will get you that 10% discount. Otherwise, lots more teaching on all of our social media channels: YouTube, Twitter, Instagram, Facebook, Dr. Amanora. Check them out. We're going to help you through your years as a GP trainee. We've got loads of courses, online courses, audiobook courses, face-to-face courses, mock exams, so much to try and get you through those difficult assessments at AKT and CSA, but that's for the future. You're a new GP trainee right now, so hopefully this video has been some value. You know the hashtag CanPass Will Pass, hashtag I went with Aurora. Hopefully we'll get to meet you soon.